Human immunodeficiency virus, commonly known as HIV, is a virus that attacks the body's immune system, specifically targeting cells called CD4 cells, which play a crucial role in fighting off infections. If left untreated, HIV can gradually weaken the immune system, making it harder for the body to fend off diseases and infections. Over time, this process can lead to acquired immunodeficiency syndrome, or AIDS. But how exactly does HIV spread? And equally important, how doesn't it? To truly understand the transmission of HIV, it's essential to first know where the virus lives and how it moves from person to person. HIV is present in certain body fluids of people who are living with the virus. These fluids include blood, semen, preseminal fluid, vaginal fluids, rectal fluids, and breast milk. For transmission to occur, these fluids must come into direct contact with a mucous membrane, such as those found in the genitals, rectum, or mouth, or with damaged tissue, or be directly injected into the bloodstream, for example, through a needle or syringe. One of the most common ways HIV is spread is through unprotected sexual contact. During sex, HIV can be transmitted when the virus-containing fluids from one person enter the body of another, particularly through vaginal, anal, or oral sex. Anal sex poses a higher risk compared to vaginal or oral sex due to the delicate nature of the rectal lining, which can more easily allow the virus to enter the bloodstream. It's important to note that using condoms consistently and correctly significantly reduces the risk of HIV transmission by providing a barrier that prevents the exchange of fluids. Another significant route of transmission is through sharing needles or syringes. People who inject drugs and share equipment are at a much higher risk because the virus can be transmitted directly into the bloodstream. This risk also extends to any situation where equipment that can pierce the skin, such as tattoo or piercing needles, is not properly sterilized and is used on multiple individuals. Mother-to-child transmission is another pathway for HIV. An HIV-positive mother can pass the virus to her child during pregnancy, childbirth, or breastfeeding. However, with proper medical care, including antiretroviral treatment, the risk of transmission from mother to child can be dramatically reduced. Blood transfusions and organ transplants used to be a significant risk factor for HIV transmission, particularly before the mid-1980s, when screening methods were not widely used. Today, in most countries, donated blood and organs are rigorously tested for HIV, making this route of transmission extremely rare. It's equally important to understand how HIV does not spread. HIV cannot survive long outside the human body. It does not spread through the air, water, or by casual contact. Everyday actions such as hugging, shaking hands, sharing food or drinks, or using the same toilet do not transmit HIV. There is no risk of getting HIV from insect bites, such as mosquitoes or ticks, because the virus cannot live or reproduce inside insects. Social interactions and sharing spaces with people living with HIV pose no threat. HIV is not transmitted by coughing, sneezing, or through saliva, sweat, or tears. This means that sharing utensils, towels, bedding, or even kissing on the cheek carries no risk of transmission. Even deep, French kissing is considered extremely low risk unless both partners have significant open sores or bleeding gums. It's worth noting that the virus is not spread through pets or animal bites either. HIV is a human-specific virus and does not infect or get transmitted by animals. There are persistent myths and misconceptions about HIV that can lead to stigma and unnecessary fear. For example, some people wrongly believe that you can get HIV by simply being around someone who is HIV positive or by touching objects they've handled. These ideas are not only incorrect, but also contribute to discrimination and social isolation for those living with HIV. Scientific evidence has shown that HIV is not spread by sharing swimming pools, gym equipment, or public transportation. The virus cannot live on surfaces like doorknobs, telephones, or computer keyboards. Even in healthcare settings, the strict use of gloves and universal precautions makes accidental transmission highly unlikely. Another important aspect to consider is the concept of undetectable equals untransmittable, often abbreviated as UPU. When a person living with HIV is taking effective antiretroviral therapy and maintains an undetectable viral load in their blood, they cannot transmit the virus to sexual partners. This breakthrough has not only improved the quality of life for people living with HIV, but also greatly reduced the risk of onward transmission. Prevention efforts play a crucial role in stopping the spread of HIV. Consistent and correct use of condoms remains one of the most effective ways to prevent sexual transmission. For those at higher risk, pre-exposure prophylaxis, or PrEP, is a medication taken daily that greatly reduces the chance of getting HIV. Similarly, post-exposure prophylaxis, or PP, can be taken within 72 hours after a possible exposure to prevent infection. Regular HIV testing is vital, both for individuals who may be at risk and for those who want to know their status. Early detection not only leads to better health outcomes for those living with HIV, but also helps prevent further transmission. Modern HIV tests are accurate and widely available, and knowing one's status is a powerful tool in protecting both yourself and others. Education and awareness are the cornerstones of HIV prevention. Understanding the facts about how HIV spreads and how it doesn't empowers individuals to make informed decisions, reduces unnecessary anxiety, and helps combat stigma. By separating fact from fiction, we can create communities that are supportive, compassionate, and equipped to stop HIV in its tracks. In summary, HIV is transmitted through specific body fluids and requires direct access to the bloodstream or mucous membranes. It does not spread through casual contact, the environment, or through animals and insects. With the right precautions, medical advances, and ongoing education, HIV transmission can be prevented, and those living with HIV can lead healthy, fulfilling lives. The key is knowledge, knowing the real risks, understanding the facts, and taking proactive steps to protect ourselves and our communities.